For decades, we have all been taught the exact same rule. If you want to catch breast cancer early, you check for a lump. But what if I told you the most aggressive forms of breast cancer in women over 60 don't always start with a hard lump? In fact, some of the most dangerous signs are completely silent. They don't hurt. They don't show up as a distinct mass you can feel when you are getting ready in the morning. Instead, they masquerade as perfectly normal signs of aging. A slight change in the texture of your skin, a little bit of redness that looks like a harmless bug bite, a subtle shift you might just brush off as your body losing elasticity over the years. But here is what most people don't realize until it's too late. Ignoring these subtle shifts gives invisible threats the exact time they need to spread. You have spent your entire life taking care of everyone else. You have done your mammograms, you have followed the rules. But the rules actually change as our bodies get older. Today, we are going to walk through the 5 silent signs of breast cancer that most women completely miss. These are the hidden red flags that specialists look for, but rarely sit down and warn you about. I am going to show you exactly what they look like, why they happen, and precisely what you should do if you spot one. This isn't about making you afraid. This is about giving you the control, the clarity, and the knowledge you need to protect your health and your peace of mind. Because catching just one of these silent signs early changes absolutely everything. For the last 40 years, every Binning ribbon pamphlet in every doctor's waiting room has taught us the exact same lesson. Feel for a lump. This goes against what you've been told, but relying entirely on that advice is actually leaving older women dangerously unprotected. The Feel for a Lump message was a brilliant public health campaign decades ago. It genuinely saved lives, and it is still a good practice. But medical science has evolved, and unfortunately, the standard advice hasn't always kept up with what actually happens to our bodies as we age. When you were in your 30s and 40s, your breast tissue was quite dense. During those years, a hard, distinct lump was often the very first warning sign. But after menopause, everything shifts. The dense glandular tissue naturally decreases, and it is slowly replaced by softer, fatty tissue. It is just a normal, beautiful part of growing older, much like the way our skin gets a little thinner. But here is the critical point. Because the internal landscape of the breast changes, the way cancer presents itself changes too. It doesn't always form a hard, distinct mass anymore. Instead, it might quietly pull on a ligament. It might block a tiny fluid pathway. It might cause a slight inflammation that you brush off as absolutely nothing. This is why acting early matters. Quick favor before we go further. Drop your city, state, or country in the comments. When I see where people are watching from, it helps me know who's listening and tailor the health advice for what you might be dealing with where you live. I read every single one. Now stay with me, because the first silent sign we are going to cover is something nearly every woman mistakes for a simple, harmless change in her skin. Let me tell you about a woman named Margaret. She was 68 years old, fiercely independent, and spent most of her spring mornings out in her garden. One morning, while getting dressed, she noticed something different in the mirror. It wasn't a lump. She checked for that right away. It was just a slight puckering on the underside of her right breast. A tiny area where the skin looked a bit thicker and uneven. Margaret did what almost any of us would do. She sighed, blamed it on gravity, and assumed it was just another normal part of getting older. She thought, my skin is just losing its elasticity. And let's be honest, it is perfectly normal to lose some firmness after 60. You see it on your arms, your neck, your hands. But here is what most people don't realize until it's too late. The texture of your breast skin is often the very first alarm bell your body rings. Sign number 1 is unexplained dimpling or a sudden change in skin texture. In the medical world, doctors call this peau d'orange. That is simply a French phrase that translates to orange peel. Think about the outside of a navel orange sitting on your kitchen counter. It has those tiny, subtle little pits all over it. If the skin on your breast suddenly takes on that exact same pitted, textured appearance, even just in a small, dime-sized patch, It is not just a loss of collagen. This is where real damage begins if we brush it off as vanity. Tiny, microscopic cancer cells can quietly block the delicate lymph vessels just under the surface of the skin. When those little pathways get blocked, fluid builds up. The skin swells slightly, and the tiny hair follicles get pulled inward, creating that dimpled orange peel look. Margaret waited 6 months to bring it up. If you ever notice a patch of skin taking on that dimpled texture, do not dismiss it. Do not wait for your next annual checkup. It is not just aging. It is a signal, and you need to have your doctor look at it that same week. Now, we have to talk about 2 other subtle changes that most women are taught to ignore, but that actually require your immediate attention. Sign number 2 is a change in the nipple or the area surrounding it, known as the areola. Most people are looking for a mass. Instead, look for a sudden inversion. If one of your nipples has always pointed outward, and you notice it has suddenly pulled inward, flattened out, or started to point in a different direction than it has for your entire adult life, that is not just getting older. This often happens because a small, hidden tumor underneath the tissue is acting like a tether. It is pulling on the delicate milk ducts, gently tugging them inward. It is silent, it is painless, and it is incredibly easy to miss if you aren't looking at your profile in the mirror. Most women see this and assume they are just seeing the natural effects of menopause. But unlike the changes that happen slowly over years, a cancerous change often happens relatively quickly. Sign number 3 is what I call focal pain, or sudden asymmetry. This is the one that most doctors dismiss as musculoskeletal, or just a symptom of a pinched nerve. But I want you to be very careful here. Most breast cancer is painless, but a specific type can cause a localized, persistent, and dull ache that you can point to with one finger. It's not an ache that radiates across your whole back. It's an ache that lives in one specific spot, and it stays there. It might be accompanied by one breast suddenly appearing larger or hanging lower than the other. I know, your breasts have probably been slightly asymmetrical your whole life. That is normal. But I am talking about a new asymmetry. If your favorite blouse suddenly fits differently, or if one side feels significantly heavier, that is a change in your baseline. Trust that intuition. I want you to stop for a second. Take a deep breath. Because what I'm about to tell you goes against everything the wellness industry tries to sell you about your health after 60. We tend to think that if we feel fine, we are fine. We assume that if we haven't seen a doctor for a problem, then everything must be working as it should. But here is a hard truth that often makes my patients uncomfortable. The most common reason cancer is caught at a later stage in women over 65 isn't because the cancer is always more aggressive. It's because we become experts at ignoring our own symptoms. We become experts at explaining them away. Oh, it's just my back acting up. My skin is just dry. A landmark study published in JAMA Network Open looked specifically at this issue of symptom appraisal in older women. The researchers found that women over the age of 60 often waited an average of 3 to 4 months before even mentioning a new breast symptom to their doctor. Why? Because the symptoms were subtle, intermittent, or completely painless. The study concluded that the time to presentation, that window between first noticing a change and actually getting it looked at, is the single most significant factor in how successful treatment is. When you wait, the options become narrower. When you speak up, the options stay broad. This isn't about being paranoid. It is about being the CEO of your own body. Most people think if it was cancer, it would be a big deal. But cancer doesn't announce itself with a trumpet blast. It starts as a whisper. Your body is speaking to you every single day. And the research shows that if you actually listen to these quiet signals, you aren't just protecting your health, you are protecting your future. This is perhaps the most dangerous silent sign of all, because it is the one most likely to be treated with a tube of hydrocortisone cream and sent home. Sign number 4 is redness, heat, or what looks exactly like a bug bite or a minor skin rash that simply refuses to go away. If you find a patch of skin on your breast that looks red, feels slightly warmer to the touch than the surrounding skin, or has that faint, persistent itching that you'd expect from a mosquito bite, you need to watch it like a hawk. We are talking about something called inflammatory breast cancer, or IBC, and this is where many women, and even some general practitioners, get it wrong. They look at the redness, they see the heat, and they think infection. They prescribe a round of antibiotics. When the redness doesn't clear up after 7 or 10 days, they might try a stronger antibiotic. By the time they realize it isn't an infection, the cancer has had a massive head start. Here is the difference you need to know. A true infection usually has a source. You might have had a small cut, a scratch, or a reason for that skin to be inflamed. IBC is different. It shows up without a reason. It is silent, it is stubborn, and it does not respond to the typical wait-and-see approach. If you have a patch of red, warm, or irritated skin that stays there for more than a week, do not let anyone tell you it's just a skin issue. Ask the question, could this be inflammatory? It is a simple, direct question, and it is the exact kind of advocacy that saves lives. You aren't being difficult, you are being informed. Now we come to the fifth sign, and this is the one that surprises the most people. It is what I call the collateral warning. Sign number 5 is persistent swelling, or a new firm bump in the armpit or along the collarbone area, even if your breasts themselves feel and look completely normal. Most women are conditioned to perform their self-exams by focusing exclusively on the breast tissue, but the lymphatic system doesn't stop at the edge of the breast. It flows outward into a complex network of lymph nodes in your underarm and right up toward your collarbone. Sometimes, if a silent, microscopic tumor is present, your body's immune system will try to fight it off long before you ever feel a physical change in the breast itself. The first indication isn't in the tissue, it's in the drainage centers. You might wake up and feel a fullness in your armpit. You might notice a small, hard, or rubbery lump just above your collarbone that wasn't there last month. Because it's in the armpit or the neck area, it is incredibly easy to mistake it for a swollen gland from a minor cold, a lingering allergy, or even just a bit of muscle strain. But here is where the silent part becomes critical. If you have a swollen lymph node that stays firm, doesn't go away after 2 weeks, and doesn't seem to be connected to an obvious illness, you cannot afford to ignore it. These lymph nodes are your body's early warning system. They are effectively acting as the guard posts. If they are enlarged, they are trying to tell you that something is moving through the system that shouldn't be there. It is not always cancer, of course. It could be many things, but it is a signal that requires a diagnostic ultrasound or a clinical check, not a wait-and-see approach. I want you to take a breath. Knowing these signs isn't about inviting fear into your living room. It's about reclaiming your autonomy. If you're listening to this, and you felt that small prick of worry because something I said sounded familiar, I want you to have a clear, calm plan for the next 24 hours. First, do not jump to the worst-case scenario. Anxiety is not a diagnostic tool. Your goal is simply to get a professional, objective assessment. Here is your next 24 hours protocol. Step 1. The mirror test. Tomorrow morning, when the light is best, stand in front of a full-length mirror. Don't rush it. Compare the two sides, not just the breast, but the armpits and the collarbone area. Look for the dimpling, the symmetry, and the skin changes we discussed. If you see something that makes you pause, take a photo. I'm serious. A photo is a powerful tool because it gives your doctor a timeline, not just a verbal description. Step 2. The no-nonsense appointment. Call your primary care physician. When you call, don't say, "I think I have a little issue." Be specific. Say, "I've noticed a change in my breast tissue. Specifically, I am seeing this change, and it has been present for 2 weeks." Being direct gets you a faster appointment. Step 3. Be your own advocate. If you walk into that office and you feel like you're being brushed off, you have the right to ask the magic question. I understand it's likely benign, but because this is a new change for me, can we order a diagnostic ultrasound to be absolutely sure? A diagnostic ultrasound is different from a routine screening. It's designed to look at specific areas of concern. Do not apologize for being thorough. Your health is not a bother to your doctor. You know, the most beautiful thing about the women I work with isn't how much they know about medicine. It's the quiet, steady way they carry themselves. But I often see women in their 60s, 70s, and beyond start to shrink their own needs. They prioritize everyone else's calendar, everyone else's health, and everyone else's comfort. They start to see their own body as something that is naturally declining, and therefore something they should just stop paying attention to. I am here to tell you that is the biggest mistake you can make. Your body hasn't stopped working for you. It is still sending you signals every single day. When you take 5 minutes to look in the mirror, to notice the texture of your skin, or to acknowledge a change in your own baseline, you aren't being vain. You aren't being dramatic. You are being a steward of the life you have worked so hard to build. You have earned the right to be healthy, and you have earned the right to have your concerns taken seriously by every single person in a white coat. If this conversation gave you the clarity you needed to stay on top of your health, please hit that like button below. It helps other women who might be worrying in silence find this information too. And if you want more of these practical, honest, and dignified health conversations, make sure to subscribe. I'm here every week working through the reality of our health after 60, without the jargon and without the fluff. You are the only person who lives in your body 24 hours a day. Trust your eyes, trust your intuition, and more importantly, trust that you are worth the time it takes to get an answer. Stay well, and I will see you in the next one.